tornadoes have touched down across the plains and Midwest, knocking out power to tens of thousands of people. Central Oklahoma has been especially hard hit. A twister flattened most of a mobile home park. It killed an elderly man as well.
This is a rapidly developing tornado that could be significant in size.
This is a tornado emergency. This is higher than a tornado warning.
Folks, this is heading into more. This is heading into more. This tornado is heading into more.
There's a huge flash right there. It is just ripping up everything in its path.
Tornado emergency for Moore. You folks in Moore, you need to grab whatever it is you need to grab, and you need to go underground.
David, I think the Moore Medical Center took a direct hit of this tornado. It's now rain wrapped. It was a quarter to a half mile wide before we lost it.
Bottom line, grab your kids, grab your loved ones, grab your friends, or just get out of the way.
Energy change, not necessarily the energy of the weather, but the energy of the people around you. It's like people get a sense that something is coming. And you could tell that people were becoming more stirred up, and you knew something was coming. So then we got everybody in the cafeteria just before it hit. The lights went off, the tornado hit, we miraculously survived. And to be honest with you, because the cafeteria was so untouched, it seemed, I really didn't expect to open the door to what we opened the door to.
Next to me, the Moore Medical Center, which took a direct hit from this massive tornado. It's hard to believe when we look at the destruction. Look at the cars just flying all over the place, the roof's destroyed.
When that hospital was destroyed, we had an entire community displaced and ultimately in a trauma situation, and so hundreds of patients flooded the emergency departments. I just happened to be the hospitalist on call that night, and I admitted about 10 patients from the tornado, worked in the emergency department, and we were, trying to manage those patients and really, traumatized, unconscious, or in a lot of pain, and so we're giving them pain medication. So the ability to get a history or to get relevant information, know what their medications were, know what their drug allergies were, that wasn't information that I could readily get. So, of course, after stabilizing their acute medical condition, I needed that information to help manage them in the hospital so I could get them home without any other additional complications. I was able to hit the health information exchange ultimately and pull down that information and coordinate those patients' care, and it was absolutely invaluable.
We had people ready to deliver in the next weeks or two, unsure of where am I supposed to go, who am I supposed to see. And we were able to harness the power of Messenger to immediately notify patients, we're canceling your appointments, but we will be calling to reschedule. We're setting up new locations. We also used Portal to send out that messages. Appointments are canceled for this week. We'll be calling as soon as possible to reschedule. If you're in labor, go to the HealthPlex hospital. If you have a medical emergency, go to either the HealthPlex or the Porter campus or your nearest emergency department. We were able to get that communication out.
It really was a lot smoother than it could have been. And it was a great relief to the patients to know that their medical records were not either in another state, thanks to the tornado, or under a pile of rubble about to be destroyed. It's a huge relief to them to know that who they are is not about to be exposed to other people. So I think that was a big patient satisfier.
Our information was located in our data centers. It was unharmed. We had immediate access to it. Our practices that were not impacted by the tornado were still able to continue functioning without any kind of hitch. And our physicians who were impacted by the tornado were able to work remotely, either through using eClinical Mobile or through using our remote tools to access the application directly.
I had one patient in the ICU that had just horrific trauma, and I kept giving him pain medication, but I couldn't get his pain under control, and I was able to get into the health information exchange, and he'd had a back issue and had been taking some pain medication, and so he had some degree of tolerance. So my comfort level in giving that patient additional pain medication then became a lot better, and I was able to get them comfortable. So, you know, I think that the value of what, you know, ultimately our infrastructure's brought us, and what the health information exchange brings us, and what the ambulatory record with eClinicalWorks really has made a tremendous impact in terms of preventive medicine, in terms of chronic condition management, in terms of handoffs, consultations, and then in the event of a catastrophe. So it's really been, you know, a tremendous partnership between Norman and eClinicalWorks, and I think we've made good use of the software, and we certainly appreciate everything eClinicalWorks does for us.